Hi everyone. We are going to touch on informatics and its improvement of workflow and meaningful use. So you guys have this PowerPoint, and I wanted to share with you this PowerPoint that I found. um, sorry, that the University of Maryland shared, which I thought was a really good presentation. So all right, so when we talk about meaningful use, I think we need to back up and talk about kind of the trends that are changing in healthcare. This is a little bit of an older presentation, so it talks about the IHI, so the International Health Institute Triple Aim. We actually now are leaning toward the quadruple aim. So the triple aim says population health management, lowering per capita costs, improving experience of care, but also in that aim is also decreasing staff burnout and increasing staff satisfaction, especially they're talking among providers. So, but really that should include all staff. Um, and we're talking about quality and payment in order to, that's how value is being assessed now. So, they used to talk about numbers and getting people in and da da da. And now a lot of our money and reimbursement is going to come via the metrics that we hit. So when they talk about, your fall metrics or Foley catheter infection rates, or for those in outpatient, asthma readmission rates, that's going to affect the way you're reimbursed by your insurance companies. So common requirements to support change is experience and data and information. So accurate information delivered to the right people at the right time. And of course, resources and enabling infrastructure. So some of you might think like, I don't really understand enabling infrastructure or resources. And that's actually staff. A clinical system that works for you, an electronic system that's easy to use. Um, uh, Even the way you order supplies is an enabling infrastructure. And of course, resources is more than just staff, but that's a huge part of it. Money, an actual building, and supplies. So meaningful use of EHR and health information exchange and interoperable systems. What does that mean? And so when EHR first got developed, part of it was just used as a logbook to keep certain types of data. And that was definitely helpful, but it wasn't necessarily used meaningfully. So what that means is, okay, you had like patients' information and their labs and their med list was kept in the EHR. But you still used a lot of paper to exchange information, and you weren't actually living up to the idea of promoting safety and continuity of care because you weren't charting in the electronic system. And so that meaningful use came into play because that's how they, and when I say they, regulatory bodies are establishing if um, hospital groups, healthcare organizations, practices are using their EHR meaningfully to reach that goal of improving outcomes and lowering costs. So healthcare slash clinical informatics. So when you think about the system, there's the EHR, the registration system, the lab and radiology system, and how those interconnect, the dietary system, the systems that monitor quality of care, the finance system, other systems. There are various settings in which this is done, right? There's outpatient, inpatient, in the community, in the school, in the prison, and then of course different stakeholders. You have the patient, you have the staff. They spelled different wrong. Yeah. So it goes on. So the health IT ecosystem. All right, so individual access and share health information. So that helps us look at quality measures, right? And so you have the patient and the practice. And then HIT, health information technology for quality and safety in care delivery. population health management and regional information exchange, and big data and analytics. So we use this for quality measures, for public health tools, and clinical research. And on top of this ecosystem, you'll see technical standards and services, certification of HIT to accelerate interoperability, and that means, the actual use of it, and then privacy and security protections. The stakeholders involved, you have patients, the actual practice, the population, and the public overall. You need supportive business, clinical, and regulatory environments, and rules of engagement and governance. And all of this leads to clinical support system. When you look at this, public health policy will be formed by public health information, and clinical research is actually going to base the clinical guidelines that we use. So this information is really important. It needs to be shared for numerous reasons, not just for the patient. And we talked about in ethics about is that ethical and why, and how we can do it ethically to protect the patient. So part 1, introduction to clinical informatics. So you're going to say, oh my gosh, Denise, why are you reminding me? But you know what? You can never know this information enough, because even sometimes I teach clinical informatics and I have to pause and think, what is the definition of health informatics? Because there's so much in it, okay? And when people ask me, what do you do in informatics? I have a limited role. I think what I do is cool and very involved in nursing, but clinical informatics, health informatics is a huge area. So it's an interdisciplinary study, and we say interdisciplinary because it involves a bunch of different disciplines of the design, development, adoption, and application of information technology. Okay, and so like I said, it was broad because someone who says they work in health informatics might only be involved in the design and development, some might be in the adoption and application, and some might just be in the application. So it's a very huge area. Clinical informatics is concerned with information use in healthcare by clinicians. So clinical informatics includes a wide range of topics ranging from clinical decision support to visual images. When I talk about clinical decision support, that's when information is brought to your attention to help you make decisions. There's clinical documentation to provider order entry systems, and from system design to system implementation and adoption issues. So nursing informatics. So now let's get down to the nitty-gritty. This is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in the nursing practice, okay? So how do we get all this data and communicate that data and knowledge so that we can improve nursing practice? All right. So clinical personnel, you have, I like to say providers, nurses, pharmacists, dentists, etc. And the focus is on patient care, and our responsibility is to manage and process clinical data, information, and knowledge to support clinical practice. So clinical informaticists, so an informatics nurse, those are those generalists who have gained experience in the field but don't have educational preparation in the graduate level in informatics. So that would be me, right? I'm not a certified informatic nurse specialist. I didn't get my master's in informatics. I've taken numerous classes in informatics and I've learned about it, but my specific master's was in family nurse to become a family nurse practitioner. And in my doctorate, I've taken informatics classes as well, but again, I'm not a master's of informatics. So an informatics nurse specialist, those are formally prepared at the graduate level in the informatics or related field. And that is a really awesome field to get into. And it is growing, 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 and there's no sign of it stopping. So if any of you are wondering what you might want to get your master's in, and you don't necessarily want to be advanced practice, which is not the end-all be-all of nursing, informatics specialist is a great area to go into. I think if I got another master's degree, my husband would kill me. So functional areas of nursing informatics, clinical informatics, healthcare informatics. So systems analysis and design, coordination, facilitation, integration, information management and operational architecture, development of systems, products, and resources, quality and performance improvement, research and evaluation, administration, leadership and management, and education and professional development, policy development and advocacy, and then genetics and genomics. So the study of nursing knowledge, conceptual framework, we look at Gave and Corcoran, 1986. So management and processing, we have data, information, and knowledge, okay? So moving from data to expert system, and information, decision support, and expert systems represents and enable the evolution of data to information, knowledge to wisdom. So when we talk about data, that's just tidbits, right? Names, numbers, and then knowledge. We interpret and integrate understanding, and then wisdom, we apply that understanding into our service. So we go from information, decision support to expert systems, and it's the same idea as data to information to knowledge to wisdom. So why do we use information systems in healthcare? Healthcare problems on this person's back and solutions. So electronic health record. An electronic health record of health-related information on an individual conforms to nationally recognized interoperability standards and can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. So why do we have that, right? Why do we have an electronic record that is consistent across the board and interoperable when you interface between EMR to EMR, so that we can look at things and safely provide care to our patient? Continuity of care, understanding of different treatments, medication reconciliation, and of course, previous imaging. I mean, there's nothing worse than when you get two CTs and are exposed to all that radiation twice just because your doctor didn't have medical records.